From April to June 2018, over 2,700 children were forcibly separated from their families under the Trump administration's zero-tolerance policy, which aimed to prosecute all migrants who attempted to enter the country outside of an official port of entry or without proper documentation. Although this policy was theoretically suspended via executive order at the end of June 2018, there have been 245 new cases of family separation between July 2018 and January 2019. Furthermore, thousands more children are estimated to have been separated since 2017, when there was no system in place to track separations. Because of this, the total number of family separations is unknown. Upon separation, these children are sent to detention centers and immigration shelters. Children at these facilities are denied human touch, deal with a lack of adequate food, water, toiletries, and medical care, face serious neglect and sexual abuse, and in some instances are even locked in cages. Many of these children are eventually funneled into foster care, where living conditions are better but long-term outcomes are notoriously poor. Since the end of the zero-tolerance policy, some families have been successfully reunited. However, the U.S. government says that reuniting the remaining families will take up to 2 more years. Despite this lasting impact, President Trump continues to push for the reinstatement of family separation policies at the border. So why should you care about the zero-tolerance policy and family separations? Unfortunately, family separation has detrimental effects on the mental health of children affected by these policies. According to attachment theory and psychology, the bond between parents and children is incredibly important for emotional development and regulation. Forcible separation from parents undermines this bond and puts children at a greater risk for developing depression, anxiety, and PTSD. Furthermore, the negative effects of family separation may be compounded by additional traumatic events. A significant portion of these children have already been exposed to trauma before detainment or family separation. 29% experienced trauma prior to migration, and 23% experienced trauma during their migration journey. Detainment during family separations can also be traumatizing for these children because of poor living conditions, constant surveillance, and uncertainty about the future. Altogether, children who are separated from their families are at a significant risk for a mental health disorder. Evidence-based treatments, including trauma-focused cognitive behavioral therapy and narrative exposure therapy, are effective at reducing symptoms of psychological disorders among traumatized children. However, humanitarian organizations are not allowed into detention facilities to provide therapy to separated children, leaving them without this key source of psychological support. So what can you do to help promote positive mental health outcomes for children affected by family separation? Number 1. Get involved. Organizations like the ACLU and the Texas Civil Rights Project are working to end family separations and speed up the reunification process through litigation. Quickly reunifying families will mitigate the negative mental health effects of longer-term separations for children. You can support these groups by signing petitions, donating money, and volunteering for the cause. Number 2. Contact your senator or representative. Ask your local representative to support H.R. 883, the Families Belong Together Act. This bill aims to grant lawful permanent resident status to families separated by the Department of Homeland Security. If passed, these families will be reunited and released from psychologically harmful detention facilities. After release, families could more easily access mental health services for their children. Number 3. Be an advocate. Promote the use of humanitarian action in detention facilities by reaching out to immigrant rights organizations, contacting government officials, and speaking out on social media. If humanitarian organizations were allowed to operate within these facilities, they could provide treatments that would promote the mental health of separated children. By taking these steps, we can work together to improve mental health outcomes of children who are separated from their families.